Hello, good evening. Assalamu alaikum. How are you guys? How's everyone doing? I hope I'm audible and visible as well. Yeah? Okay. Okay. Hi, Man. How are you? Good. Good. That's great. Okay. So,
Fine,
guys.
great, fine, thank you.
All right. All right. So, okay, fine. So let's get started with our the session. Today is the 12th session of the series of the prep hour. So in this we are going to talk about the patient safety. Okay, I'm not going to take any the station because we do have to cover the a lot of the points, because I do see on day-to-day basis that what kind of the difficulties students they do face, because the patient safety somewhere is a point where sometimes we do the lack in terms of that, sometimes we do miss so many things, sometimes we do the come across with difficulty in one or the other the station. So in this we are going to talk the little briefly about the patient safety. Later I am going to take the questions, because this is going to be the last the session before November exam, because of course then I'm going to be super busy. In fact, I already am, but I really wanted to finish this on a good note, that at least you guys will be able to the learn out of all these the sessions. Okay, so I hope it has helped you guys as well. And well, it has helped me too, because because I have to work the every week, so I have to come online every week. So I am studying as well, I am learning day by day as well. So this is in a way the very good. This is in a way that I have to the improve on my skills as well. I have to improve, I have to study, I have to study a lot. So this is really helping me. So thank you. I mean, thanks all of you guys as well, that you guys are so the amazing. You are coming in every session, you are trying to the perform. So this is very good. And because the November exam is just right away, right around the corner, so I think it's better that you guys should be on your own, revising your own stuff. Okay. And in the last the few days, I think today is 21st, so 9 days and 7 days. Okay, right? So from 7th of November exam is going to start. So in these last days, try to stay focused, try to revise your own stuff, try to revise the guidelines. Don't forget a structured discussion task. Okay, so this way or that way you have to do both in real exam, isn't it? So you have to do communication and the skills task as well. You have to do the structured discussion task as well. So for structured discussion, of course, you have to study, you have to revise. So revise your stuff, don't ignore. Okay, so fight for every station, do try to they work hard for every station. And trust me, it happens in real exam. I've been through this exam. Okay, so of course it happens in exam that sometimes you get tired one after one, the 14 stations, of course, and sometimes it gets the very hectic physically as well. So try to mold from now onwards. I mean, whatever you are doing, so try to practice with your study buddy in a way that that you are performing couple of the stations in row. Okay, so it will give you practice, and it will give you the hold on your own breath as well, and how you are going to move from one station to the other station, and likewise. Okay. And so in terms of the patient safety, like I said earlier, that this is going to be the last the session before the exam. Maybe I will take the one more on queries and booster the queries, you must say. So queries maybe just close to exam, maybe on 4th or 5th, okay, of the November. So I will try and I will announce whatever time I will find feasible according to my own schedule as well. So before I move to this, I just want to tell you guys is I just have 2 slots left for November mock exam. If anybody who is interested to book the mock exam with me, so please get in touch with me or the med exam expert team. Because seriously, I feel so bad, when I have to say no, because I know that, maybe somebody needs, the me at any point, maybe somebody needs to practice, the mock in a proper way. So if anybody is interested, so I just have two slots. Okay. So I can just take two more candidates. Otherwise, I am almost, the fully booked. All right. Yeah. And for the February batch, I'm taking candidates because, usually I don't take so many students. So one batch, 6 or 7 students, that's it. And in my, the session, every, the student performs. And of course, with the passage of time, I do see their progress. I do see how they are, the moving along with the course and everything. So of course, it is a two-way learning. So, if you are not going to, the show any interest, none of the mentor, none of the teacher is going to guide you. All right. So let's move on to our patient safety. So what is patient safety goals? So generally, internationally, we do have, the patient safety goals. Yeah. So generally, internationally, these goals are divided into six, the things. And if you just, the keenly look at this, you will 100% get this idea that, okay, almost all these things we do apply at NHS as well. First of all, identify patients correctly, improve effective communication. Yeah. Right type of sentences, right type of, the words, expressions. Like I always tell you guys that your facial expressions, your body language, your facial expressions and language, okay, it doesn't mean that you are being soft, but you are not showing any kind of emotions. Okay, you're not showing any kind of, for example, if patient is upset, for example, if patient has had some kind of bad event, and nobody is showing any remorse, nobody is showing, any kind of, the concern. Patient is concerned and we are just like, blank. No. Okay. So nonetheless, whether it is online exam or, the face to face exam, you are dealing with humans. So while we are interacting with humans, so we have to show, the our own, the human skills as well. Okay. So don't just try to be, the very robotic. And while you are, talking to anyone, okay, like we do normally, that sometimes, we do try to emphasize on something. Sometimes we do repeat something. Sometimes we do ask that, am I clear? Am I clear so far? Do you think that I need to, the repeat anything for you? Do you think I was not clear about anything? This is what we do in our day-to-day practice, isn't it? So same you have to repeat with the exam, the role players as well. So don't forget, this important thing. Plus, don't be so mask face all the time. Try to show, the any kind of, there should be a, the very subtle, the expressions on your face. Okay. Like, half smiling. You can, the simply, the break the ice while you are entering into the cubicle, that okay, hello, good morning, how are you? Okay. If it is not the breaking bad news, if it is not something in which you can which you are going to face a volcano, of course, you have to be like, kind of a human being. Like, this is all we do. Like, we are, the entering in our hospital, okay, in our clinic, we do say, the hello, hi, or salam, according to your own, the rituals or anything. Okay. So likewise, don't forget to do this in real exam as well. Improve the safety of high alert medication. I will talk about in a while, okay, in bit detail, because this is where, the most of the candidates, they get stuck. And this is where I feel that, everybody needs to work on. Okay. So let me, the talk in a bit detail. Then the fourth goal is going to be ensure correct site where you are operating, correct procedure, and correct patient in terms of surgery. Number fifth, reduce the risk of healthcare associated infection. So that's why we are giving them antibiotics. And before giving antibiotics, what is the major patient safety? Allergy, right? So don't forget to exclude allergy. If you find out from your history that okay, from in terms of management, I have to give him or her, any kind of antibiotic. So of course, even if you miss in that, the particular template, and while you are going to prescribe her with antibiotics, so at that time you can simply ask that, oh, I'm sorry, I forgot to ask you, are you allergic to anything, or the or any particular medication? Usually, the uh, not like, in NHS, but even in our country where we do practice, we do see, the many women who are aware of their, the medications allergy. A few days ago, I come across with paracetamol allergy. Okay. And the penicillin allergy is very common, metronidazole allergy is very common. Some women are, the sulfa allergic, isn't it? While somebody is telling you, stop there, Stop there and just say, okay, fine. This is a very important, the point. Thank you so much for telling me. I will write down in your notes. So everybody will be aware of that you are allergic to penicillin, you are allergic to metronidazole or whatsoever. Okay. So, I mean, change your, the kind of history pattern. Okay. So don't just try to be very robotic. Like, I mean, I'm sure you all know and what I'm talking about, that everybody is so well versed of, the set templates, set questions. Okay. So try to mold them, try to change them according to the situation, according to the the how patient is taking the the station. Always, once patient has given you enough information, take the charge of the station. Okay. Then, because in 10 minutes you have to prove yourself as well that you are a good doctor, that you are the safe and sound and the a good doctor, safe practicing doctor. Okay. So then comes that the reduce the risk of the patient harm resulting the from anything. So of course, you have to ensure patient safety as well in, like, I mean, all terms. Now we are going to talk about, apart from this, the general rules of the patient safety. So we do have some the general rules of patient safety. I will be asking the one by one for every point. So anyone who is ready to speak can speak to me. Okay. And they can they tell me. So the first and foremost important general rule for the patient safety is going to be the understanding your responsibilities and limitations. What does it mean? Anyone?
Yes,
What does it
Doctor.
mean?
Yes, Dr. Zaib.
Mhm.
The responsibility, for example, in one operation, what I have to do, and if there is, I need for help, I must immediately call for help to
Mm.
help me in the complication like injury of ureteric injury or bowel injury
Mhm.
or blood vessel injury. I must call for help, call my consultant, call my senior, alarm the anesthesia doctor and the
Mhm.
operative theater staff to be ready with the equipment and with the drugs or medication must
Mhm.
be ready.
Mhm.
Um,
Yes. Apart from that, the limitations means that until and unless you are signed off, until and unless you are, the ready to take any procedure on your own. Okay. So that's why we call it as signed off. Okay, signing off. So until and unless you are signed off for any procedure, so of course you cannot perform that procedure. Okay. So you have to understand that, okay, this is not my up to my limit. This is not up to my, the job, the responsibility. So you have to involve your consultant. Okay. So this is the very important, the first rule. The second is going to be knowing when to seek for assistance, like Iman, the perfectly said, that you have to stop the procedure there and then if there is any intraoperative operation operative the complication. So you will stop there and then you will involve your respective colleague, and that's it. Third is going to be respecting patient confidentiality. Patient confidentiality in the context of data protection, sharing or not sharing information with the family members, and when to do so. When to do so. This is also important, isn't it? Especially in the context of the Mental Capacity Act and the patients who do not have attained the age of the maturity, for example, less than 16 years. Okay. So of course, in that maybe, the if it is written clearly in the the question that she very well understands the pros and cons of the particular procedure, or she very well understands, and so this is how we assess what is the the normal definition of the when we say the mental capacity. When a patient can understand, reproduce. Okay. When patient can understand the given information, and when patient can reproduce the same information. So if at all we have to check the mental capacity, so in that scenario, how we are going to do that? We can simply ask that, okay, so Julie, I have told you the same information, so can you please tell me that what I have explained to you. Mhm. Okay, so this is how you are going to the judge mental capacity. Mental capacity doesn't have the any kind of the performa to fill or to check or something. Okay, this is your job as a doctor, that how you are going to perform until and unless there is any other issue involved. Then being able to undertake tasks which are expected in that the particular the station, like safe prescription, appropriate investigation and interpretation of the results, and instituting the right treatment, managing the complications, and etc., etc. So it means that, for example, I have a scenario, I have been asked to do that, but I don't know what exactly was the treatment. So what you are going to do in that scenario? Anyone? You don't remember somehow, what was the treatment, and it happens, it happens sometimes that,
I
okay, I
we will
certainly, suddenly forgot, the what was the treatment option.
yeah, I will get help to get the help from any senior doctor or any or I will refer to my consultant, or I will get help from my senior or from senior
Exactly.
colleague.
Exactly. Okay. So, the safe prescription, even if you don't know anything, and that happens, the other day I was taking, one of the station, and, the student, the luckily forgot, the treatment of the bacterial vaginosis. Okay. So, of course, it happens. And usually, I'm sure, if they are in normal situation, nobody will forget bacterial vaginosis. We do treat bacterial vaginosis on day-to-day basis, isn't it? But in the exam, the condition, sometimes, it happens. We tend to forget, the easy stuff, and we tend to remember, the difficult things, which in normal days we feel that, okay, we are not going to memorize them. Okay. So always remember, in that scenario, you can say that, I'm sorry, I don't remember what exactly is the treatment, but I will, have a quick word with my consultant, and or I will ask my consultant, and then I will let you know that what exactly is the treatment option. So safe. You are being safe, you are being a good doctor, you are being a safe doctor, you're not prescribing her with any of the antibiotic or any of the treatment which you don't even are sure about. Okay. Plus, don't forget to justify what exactly do you want to do. For example, I want to do the urine dr, or I want to do the urine, the midstream urine sample. Why you want to do, you have to tell. Why you want to do full blood count, you have to, the justify. Why you want to do the liver function test in anything whatsoever, why you want to do renal function test in anything whatsoever. So try to justify that. Okay. Don't just say that, we have to see whether you're, the this thing, we have to do, we have to run couple of investigations, blah blah blah, but justify them, that why it is very much important in this particular, the condition, in this particular, the situation of the health, what patient is facing. Okay. And then, managing complication, I'm sure you all know that you have to stop the procedure there, and then you have to involve your consultant, you have to inform theater staff, you have to inform, the ODP nurse, you have to inform anesthetist as well. Okay. If patient is in under spinal, you have to calm her down that this complication has happened and we are trying to deal with it. All right. So everything is going to be in the one frame, it's not going to be step by step. Okay. So if it is, you are dealing with emergency, so just imagine that you are in that particular, the situation. So I'm sure you are going to deal with that emergency in a good way. Then comes respecting the patient's dignity. Yeah. For example, the dignity means that if you think that, you need to examine her, then of course you are going to the examine in the presence of chaperone. If it is a very intimate, the examination. All right. For example, you have to do the per abdominal exam. Why you want to do, you have to tell that. If you want to do per speculum exam, then why you want to do, you have to tell her that. If you want to do bimanual exam, then why? If we are touching anyone, so we have to have, the any kind of reasoning behind that, why do we want to touch, why do we want, this examination. Okay. So dignity, this is very much important, that you at all, the times, and trust me, this we do see in our countries as well. Luckily in RCOG, we don't have, the any dummies, in which we have to perform, because we don't have long cases. Yeah. But you usually see in long cases where we have to perform, the while in our country, we do have, the real, the patients. We don't have, the all in long cases, we do have real patients from hospital. So in there, they do see that whether we are, respecting the patient's dignity or no, whether we are, uncovering them, covering them, are we asking them, that, okay, I'm going to uncover you up, the till what, the mid thigh, then why you want to do, and why you want to uncover her. Then after doing the examination, you are going to cover, the patient again. So this comes, and this I have seen in the Irish exam as well, because in Irish exam, we had, the long case as well, although there was a dummy, but they did it, On the dummy, the examiner, he removed, the complete, the sheet from the patient. Okay, so I had to, bring the sheet, whatever, up to, the from, the area I, the completely covered it. And then, I said, I just need to uncover patient from this part to this part. Dignity is very much important, especially in the intimate examination. Okay, so of course in MRCOG we don't have such, the patients, we don't have to ask them to lie down on the couch and then we have to do, and we don't even have to do the examination, especially. Okay, so of course in that scenario you are going to say, that I might need to examine you in the presence of chaperone. Okay, I might need to do this examination in the presence of chaperone, and this examination, please, please, this is going to be my humble and sincere suggestion to all of you who are here and listening to me at the moment. Okay, please don't say that, because we are in online exam, so I'm not examining you. But while we are going to, while I will see you in, the real, the scenario, or the face to face, I will do the examination. I have problem today. You are going to see me after 2 years. So do you think that I will be having the same problem after 2 years? Please don't do that. Okay, please don't do that, because I'm being a teacher, I do see, the couple of these, the things, going on here and there. It is, the very insensitive, and it looks very, the stupid as well, I'm sorry to say. Okay, so don't do that, please. So even, the while we were in face to face exam, I was in face to face exam, we never said that, okay, I have to do the examination in every case, until and unless it is needed, until and unless it is needed for your management, for you think that, okay, I cannot go from here onwards if I don't have pervaginal findings. How am I going to, the manage this woman if I don't have any per-abdominal findings? So how am I going to proceed further? All right, so examination is not even necessary, and, to be in particular, this sentence is not even necessary at all. Okay, so be extremely careful. Then you have to respect the religious beliefs. Yeah, and for example, if she is Jehovah Witness, and, she is not accepting any kind of blood transfusion products, including some women, they don't even want to take, the anti-D as well. So if you think that, in your case you need to do the blood transfusion as well, for example, it is a case of surgery, for example, it is placenta previa, for example, abruption, rupture, in which it is very, the likely the patient can have, the transfusion, multiple transfusion. So in that scenario you can simply ask that, do you have any reservation for the blood transfusion or anything? Okay, or if patient is, the Rh negative, so of course in that scenario you can ask that, along with NTD, maybe or may not be. Okay, plus, NHS is a, the multicultural, you can say the place where you will see, the multiple ethnic, the population from all around the globe, right? So in particular, you can see, the Muslim population, you can see, the Hindu population, you can see, the any population, any of the countries. All right. So, of course, they do have, the different religious beliefs apart from this Jehovah Witness as well. So in that scenario as well, if you think that, this is a case in which, it is written that, she has just been migrated from African country, she has just been migrated from an Arab country, she has just been migrated from Pakistan, Bangladesh, India. Okay, so in that scenario, at least you have to ensure that, the what you have to ensure that whether she can understand your, the nature of, the talk, if you are going to talk. In that scenario, you have to involve what? You have to involve interpreter. Okay, and don't forget to involve professional interpreter. These days, the professional interpreter, they are, the available over phone as well. So they do take, the phone calls, and they do try to, the what you can say that, the forward the communication. Okay, so in that scenario, if you see in question it is written, something like that, so be extremely careful that in this you might have to touch the word professional, the interpreter. Okay, this is very much important. This is going to be again patient safety. You don't know, the two people, for example, there is a, the very beautiful, and it's a, the strategy video as well, strategy or Vimeo. There is a, the couple from, the Indian Punjab. Okay, and there is a husband, who is settled in the UK for the quite some the time, and he brings his wife, and his wife has had the previous 4-degree perineal tear, and she was still symptomatic, and but he was insisting that my wife has to have the vaginal delivery again. And they were talking in Punjabi, and they were telling that I do have this problem, and I don't want to go for the vaginal delivery because I'm still having the fecal incontinence. But he was translating in a very wrong way. He was saying that no, 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 my wife is okay, and she says that yes, I want to go for vaginal delivery. Then of course wife doesn't have any kind of understanding of English. Okay, so that's why the professional interpreter is very much necessary. I think there is a very beautiful video, and if I find out I will forward in the MRCOG part 3 guide group. Okay, so you guys can the watch, and you guys can see that how this is going to be jeopardize the patient safety. Yeah, so it is very much important. Then comes the cultural diversity, like I have said, and implications for OBG, like FGM, and the law to the FGM, that how you have to safeguard, the other children as well. We know that, the FGM is quite common in some of the African countries, right? So if you see that, the patient has had FGM, and now she has had, the birth of the girl. So of course, she is going to be at risk of that. In that scenario, you have to involve the safeguarding team. You have to write down that in the red book, okay, and then you have to involve, of course, this girl can be at risk of having FGM as well. There is, I think, a scenario on the FGM as well. Not scenario, sorry. There are multiple, the questions on FGM as well. So do try to revise this question too. This is important. Then comes, the clinical governance with an emphasis on audit. At least you have to know that what are the principles of audit, the audit cycle, then how to use audit reports in, the mother and baby reducing risk through audit and confidentiality, what we call it as MBRACE. Remember, what are the scenarios in which we have to report to MBRACE, and what are the scenarios in which we have to report to certain, the bodies. This is also patient safety. For example, if there is any mesh related complication, to whom you are going to report? Anyone? TBT, TOT, mesh related complication. To whom are you going to report?
Mehra.
MHRA. Yes. Yes. Okay. MHRA, you are going to report to MHRA. Then, if there is, the OHSS, you are going to report it to whom?
HFEA.
HFEA. Yes. You are going to report it to HFEA. This is important. But if there is death because of the OHSS, whom you are going to report? MBRACE. Okay. These two things are there in the OHSS guideline. So be extremely careful that you have to tell it to the woman as well that okay, I have to report it to HFEA, and I will involve your consultant, and then we will see that whether we are going to proceed with the treatment ahead or no, whether we have to halt the treatment there and then. Okay. So this is going to be according to the situation. Then you have to be familiar with the few of the things, all RCOG guidelines, GMC guidelines, and documents on consent. Consent is very much important, right? Consent, the consent comes in terms of the multiple questions. Consent on laparoscopy for endometriosis, diagnostic laparoscopy. Okay, it can come as the laparoscopy for the simple cystectomy. Okay, so it can, then they can ask you the multiple things regarding the cyst and the multiple things. Okay, so you have to read the consent advices, because at that point, of course, you have to talk to the woman in the layman language. Okay, and in here I want to suggest you all that don't try to talk in percentages. Okay, rather you can simply say that 4 out of 100, that is 4%. Okay, if it is if you really want to concise it down again, you can say 4 in 10 women. Okay, if it is 40%, 4 in 10 women. Okay, so this is how you can simply break it into the layman language. Okay, so sometimes patient do understand percentage, but it's a good idea that if you are going to talk in terms of that 4 out of 10 is going to be 40, and then 6 out of 10 60, and something like that. Okay, so revise your consent form as well. It is very much important. Review the NHS consent form number 4. This is going to be for the adults who lack the capacity to investigate and treat. Okay, I think because in the some of the exam scenarios, there were any questions on the mental capacity as well, lack of the mental capacity and all. Plus, the clinical governance audit, we have just, spoken about the audit cycle. So 6 steps of audit, it should be on your tips. So if somebody is asking you to, describe or, the critically appraise the audit, so of course you are going to start like, okay, I'm going to critically appraise the audit cycle by keeping in mind the 6 steps of the audit. So at least examiner will know that, okay, this student has a basic knowledge of audit, that what are the 6 steps of audit and how, the he or she is going to, the critically appraise. Plus, you need to understand, in a very superficial way, that how to produce protocol guidelines and incident is important, right? I think, I'm sure you all are well versed with, the incident reporting, that, we always say that, okay, I'm going to do the incident reporting, I'm going to do the incident reporting. So incident reporting, adverse events, or, the never events. So never events, what is the definition of never events? Never events means the events which should never happen normally, okay, which can be avoided, if they can be fixed, the properly. So we do have, the trigger list for maternity. We do have trigger risk, the incident reporting in gynecology. So, the well versed with this in terms of, the audit, then we do have, the risk management. Risk management is very much important. Yeah. So, this is very much important that you do, and do revise this, that, in what type, not every case needs to be reported to, of course. You cannot put the burden on, the certain department. Okay. So at all times, you have to have these two lists in your mind, that, okay, these are the proper, the maternal incidents. If there is any maternal death, if there is undiagnosed breech, shoulder dystocia, blood loss more than 1500 mil, this is in the maternity. Return to theater because of any other thing whatsoever. Eclampsia, hysterectomy, laparotomy, obstetrical hysterectomy. Yeah, it can happen. It is a never event. Yeah. Anesthetic complication, ICU admission, VTE, pulmonary embolism, third, fourth degree perineal tear, unsuccessful forceps and ventouse, uterine rupture, readmission, so and so. This is important if you stillbirth for more than 500 grams. Apgar score less than 7 at 5 minutes. This is alarming. Okay, this is important. If cord pH is less than 7.05 and arterial pH is less than 7. Arterial and 7.1 less than 7.1 venous. Why? Because if you don't report them, and if they come afterwards along with complications, so of course you are going to be in danger. Okay, so incident reporting is very much important, keeping in view that, you are going to learn from your own mistakes. You are going to have, the proper audit, risk management. Then the lessons are going to be disseminated. Okay, then you are going to be, learning from all these, the mistakes. In terms of, the gynecology, this is important. Damage to the structure, ureter, bowel, or vessel, delayed in the misdiagnosis, anesthetic complication, VTE, unplanned ITU, omission of the planned procedure. Why? Why we could not do it? Was there any kind of problem? Was there any kind of, any issue? Unplanned return to theater, unplanned return to hospital within 30 days. Can you see? Within 30 days. If patient is coming back with, the post-operative complication, for example, if it was an obstructed labor and you have done second stage cesarean section, and she is coming, the 10 to 14 days with zygovaginal fistula. Okay, so this is going to be incident reporting as well. Okay, so always remember, when anybody is coming to you along with, in which, you think that you have to do the, the DETX or the incident reporting. So of course, in that scenario, in the post-operative or postpartum complication, if it is not, they happened from you, if you were not the primary attending physician or surgeon, if it was from, the other of the colleague, but at the same time you have to be very cautious. Okay, at least you have to show, some of the, I'm so sorry that this has happened to you. I'm so sorry that, you are going through such, the difficult times. I'm so sorry that you are, the going through such, the tough time at the moment. Okay, plus at the same time you are going to ask that, how are you coping with this? Okay, I'm so sorry that, I don't know what exactly has happened with you, but if you allow me, that I will go through your, the case reports or, the case notes, and then I'll be able to tell you that what exactly was the reason for this complication. Okay, so be extremely, show something from your face, okay, from your voice, from your body posture, that you are worried, that you want to, alleviate her, the anxiety, and you want to talk to her. Okay, so be extremely careful that, in what scenario you have to do the incident reporting. Then comes, the how to respond to these, including MDT, in which, MDT usually are going to be in the gynecological cases. Okay. For example, you have to send any woman to urogynecology MDT. For example, you have to send the woman to oncology MDT. Okay. So it is important if you have to involve anyone in the ops cases. So of course, in that scenario, you can say that, I can, put you in touch with, any of the consultant if there is. Okay, your care is going to be the shared care. Okay, usually in ops cases, we do have shared clinics, isn't it? We do have shared care. Okay, so it's better to say shared care in ops and MDT in the gynecological cases. The never events we have just, the spoken about. Then we do have, some of the local and the national document and the guideline on the safeguarding on the children, and how we are going to behave with them. Then comes WHO checklist. Very important. It is very much important before any operation that you have to say this, that, after WHO checklist. So extremely, you have to be well versed with WHO safety checklist. Okay. And it is different for gynecological procedure and it is different for maternity cases. Okay. So be extremely careful. Do try to, the look at that, and just in case, if any question comes out of this, but usually this is a very basic stuff and it should be on your mind. Okay. Then this R4, anybody has any idea what exactly it could be? Why I have put this, the 4 R's? Anyone?
Risk,
Mm-hmm.
first, risk factor,
No. Is there
no,
any F?
risk management team,
Okay.
then what else?
Reporting.
Reporting, yeah, reporting.
Okay. And what else? There is 4R. 4R is my
Regular
favorite,
checkup.
my student Rizwana. Okay. So of course, no. It is right drug, right dose, right route, right time.
Yes,
Okay.
yes.
No, Yusuf. It's not that. It's not that. Okay. So it is right drug. Okay. Right drug, right dose, right route, and right time. It is 4R. This is very much important because, by applying this, the 4R, of course, you can identify errors on the drugs and the monitoring charts as well. Right. And the 10th rule is what? WHO safety checklist and where it applies. Very much important. Okay. Now, if we talk about in terms of right drug, what are the important patient safety, the checks in our, the curriculum, part 3 curriculum, according to the guidelines? Can you guys name any? Okay, let me simplify the question. In what scenarios we cannot give non-steroidal anti-inflammatory drugs? Number 1.
Kidney disease, any kidney disease.
Okay. Number 2.
Bronchial asthma.
Asthma.
Okay.
Bronchial asthma.
Yeah.
Okay. Apart from
And
that,
also sepsis.
sepsis. Sepsis is very much important. 3. Number 4.
Gastritis, gastric.
No, sweetheart. OHSS. Don't forget OHSS.
OHSS,
Okay?
yes.
Don't forget OHSS. For example,
Yes,
if you want to
very
talk about,
important.
the pethidine, okay, to be very particular, pethidine. So why, in which situation you cannot give pethidine?
Sickle cell disease.
Sickle cell disease, epilepsy, and
Sickle cell disease.
OHSS. OHSS, same, it's going to be the same. It is very important. See, if you are not going to say this, patient is of OHSS, and you have to give her pain relief, you have to give her painkiller. If you are not going to say this word, you are going to fail the patient's safety. Okay?
Dr. Zaib,
Because it is very much important.
Excuse me, Dr. Zaib, why that OSS will not give pethidine?
Okay, this should be my question. Why we are not going to give pethidine? No, I'm not talking about pethidine. Pethidine is what? Non-steroidal anti-inflammatory drug, isn't it? It's a strong opioid.
Uh-huh.
Okay, so we can
That's right.
in the NSAIDs we cannot give in OHSS basically. Okay, why we cannot give NSAIDs? Because already there is going to be hypovolemia. There is going to be the some of the the problem with the kidney function. So it's better not to give the NSAIDs. And it is clearly written in guideline that we don't have to give the non-steroidal anti-inflammatory drug in the OHSS the patients. Okay, because
No,
of
but pethidine, why we cannot give? Same reason. That oasis.
Pethidine we can say, but it is not like pethidine is opioid. Okay, so usually it's better not to give the NSAIDs and all these drugs. It is written for NSAIDs, but not exactly the pethidine. But pethidine cannot be given clearly. Sickle cell disease, epilepsy. In these
Yeah.
scenarios, we don't have to give.
Yes.
Okay?
But oasis, I didn't heard before. That oasis
You
pethidine we
can
can.
say, you cannot say, but we are not
Right.
talking about pethidine. Okay.
Okay, thank you.
Anyway, okay, and right dose, of course, you have to give the right dose as well, right route as well. For example, if you have anything, the which is just to be given by IV. Okay, for example, we have to give any drug which needs monitoring. Okay, for example, we have to give drug, the that needs, the at the right time. So this is very much important that when we have to give and how we have to give. This is very much important. So always remember in terms of the plus, the right drug means which of the drug is the indicated in pregnancy and breastfeeding, which of the drug is not going to be indicated in pregnancy and breastfeeding, and in particular the situations as well. So be extremely careful that you have to know about that, what are the drugs which are freely to be given in pregnancy, what are the drugs which are contraindicated in pregnancy, and the breastfeeding as well. Okay, apart from the any pathological situation. Then it is very much important. I hope you guys will remember now. Right drug, right dose, right fruit, and right time, which is termed as 4R. Okay. Reflective practice. If you have, the apart from this, reflective practice is what? Reflective practice is that you have to reflect back on your own practice, what exactly you have done. Okay. So reflective practice is going to be what exactly was the situation or incident. What have you learned from that incident? What would you do differently to avoid that particular incident? And how would you improve on yourself to avoid all these incidents? How do you think that it has changed, I mean, your narrative, or it has changed your perspective towards your training? If you think that you need any kind of the extra time, if you need any kind of extra training, if you think that you need anything to avoid that particular incident, okay, so that is going to be reflective practice. So extremely, the be trust me, exam is not like, I mean, totally out of the box or out of the syllabus, of course. Okay, things are going to be there. Don't unnecessarily get indulged yourself into the things which are not requirement of that particular session. Okay, so be extremely careful. If the patient is crying, if the patient is having any pain, any problem, so do try to understand that you have to have the knowledge and the idea how you are going to deal with someone's pain, someone's the suffering, or someone's the kind of, you can say that, misery. Okay, so in that scenario, please refrain yourself from that, the long history questions. Okay, so don't unnecessarily say that, okay, let me ask questions first, then I will come and address your situation. Okay, that is okay, but still, it doesn't look nice. Okay, that if we will just, the if somebody is asking again and again, no, 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 please tell me what exactly is in the report. No, 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 please tell me what exactly. So, but still you are adamant that you are going to tell her again and again. No, 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 let me ask question first. Otherwise, I will forget. So don't do that as well. Okay, don't unnecessarily give the tension, because I think we have discussed the quite the sometime that for the breaking bad news, I mean, there is no hard and fast rule. Okay, so you have to go according to the patient. If patient is insisting again and again, so please don't give her unnecessary stress. Okay, just give her news first, give her time to absorb that news, and then afterwards you are going to address that, what you are going to do, how you are going to manage, how you are going to address her concerns and all. Okay, likewise, you have to mold yourself according to the situation. Okay, so don't just try to drag things, don't just try to repeat things. If there is enough information outside for the 2 minutes time, don't just try to repeat it again and again. Okay, don't just tell her that, okay, I understand that you are having epilepsy and now you are planning to become pregnant. That's why you are here. Okay, this is for you. This information is for you, that you are in preconception, or you are running a clinic with your consultant, and now you have to do the preconception care of, the so and so patient. Okay, so this is for you, this is not for the patient, that you have to narrate the same question to her. Okay, she is here for preconception care. Just tell her that I understand that you are the having epilepsy, and now you want to conceive, am I right? Yes, doctor. So tell me, what are your the concerns at the moment? So go very smoothly. I mean, it's not a bad idea that if you start your session in every cubicle with good morning, good afternoon, or good evening, whatever the time is according to you. Okay, and it's not even a bad idea that if you say hello, hi. I mean, this is extreme. So be extremely the yourself. Be very natural. Don't just try to be robotic. Don't just try to the behave like, I mean, a kind of a robot. Okay, you are dealing with humans. No, I mean, doesn't matter if they are online or if they are face to face, but still, the human are there. Okay. So be extremely careful that, how you are going to deal with the humans, and how you are going to, they talk to them. Okay. So for the, all these, the days, my advice is going to be, because, I just got a message in private. So how we are going to utilize these, the 14-15 days. So be yourself, work on yourself. Okay, so this is going to be my humble suggestion, that just work on yourself, that how just rehearse with your study buddy if you are with. So how you are going to enter into the cubicle, how you are going to break the ice, how you are going to start your the consultation. This is very much important. Okay, for every 10 minutes time you have to prove yourself. For every the station, don't get tired. This happened with me, trust me. Okay, in my first exam, I got so tired by like, I mean, station number 12. Okay, and why? The reason later on, I figured out that what was the reason, because I was in very, the uncomfortable shoes. Okay, so I got, the literally physically tired and emotionally as well, because of, the same, because I was in RCOG, of course, the face-to-face exam. So of course, it was kind of, the cumbersome at that time, that, you are facing, you are just going one by one, you are just running from one booth to the another booth. Okay, so it happens, it happens. Okay, so the candidates who are going for the face-to-face exam, dress very nicely. Okay, it should be very the good attire. Okay, it should not be very funky. You should look the very non-professional. Blue black is a good color, okay, to wear for any exam there is, even for the online exam as well. So even if you want to, for example, for the the subcontinent, the South Asian, the countries, if you want to wear any kurta or any the, even if you want to the take the veil or anything, so it should be in the very nice the light color. It shouldn't be dark orange, pink, green, or something like that. Okay, so be extremely nice. For the boys as well, you should look very the professional. Okay, and it's not even a bad idea that if you wear a tie and wear the white, off white, or the sky blue shirt, and along with the dress pant. Okay, never wear jeans in exam. Okay, it doesn't look nice at all. And all the time, you have to look professional. Okay, so dressing is very much important. Your dress code, if you want to have the scarf, so scarf should be, it shouldn't be so tight that you can't wear anything. Okay, and it should not be with so many pins, the here and there, here and there, and all the time you are, the fixing all these pins. It looks very untidy. Okay, so you have to look, the very, the petite and very good doctor at that time. Okay, so be extremely careful that you don't look lousy. You don't look, the very kind of unorganized person. Okay, and like I said, that blue black color is good. And for the girls as well, that if you want to wear the pant coat, it looks very elegant, it looks very good. So do wear it if you are in face-to-face exam, even in the online exam as well. So I mean, you can they dress up very nicely. So do that. And apart from that, don't take anything with you. There is not going to be enough time to even revise a single thing. Okay, be on time. Okay, even if online and the on-site exam. So be on time. Have your the proper passport with you, because that is going to be your the ID with you. So I mean, be on time. Be there. One day before night, before exam. The sleep properly. Go with the the good breakfast. Don't rely on anything that, okay, I will have something. Yes, they do have, the coffee, I think, or tea, and some, the biscuit. So if at all you want to take, you can, but otherwise it's a good idea that you don't go empty stomach from your, wherever you are staying at. So what else? Any other question, guys? So I think these are the, the last few moments, the tips which I
Ex-
can, give all of you. Any question?
Excuse me, Dr. Zaib.
Mm-hmm.
You already appeared the face to face. So
Mm-hmm.
hysterectomy, that case. So they ask you that about the clamp name and
Yes.
where is you will use the
Yes.
carb and
Yes.
straight.
Yes. Yes. They will ask you that, you have to perform hysterectomy. Now you have to choose the instruments and now tell that, where this instrument is going to be applied. So of course,
Mhm.
that is important. Yes.
So carb should be in the uterine vessel, and the also
Curved, you mean? Okay, sorry.
carb,
Okay,
carb,
curved. Yes, 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 yes.
uterine vessel,
Yes.
and also uterosacral and cardinal ligament.
Uterosacral and yes, they are, the below. So of course they are going
Carb,
to be curved. So, the up, there are going to be the straight, and you have to hold, the both, the sides of the uterus, and you can have myoma screw. So whatever you want to do in your, the hysterectomy, so go accordingly. And yes, memorize steps of hysterectomy as well. This is important too. Vaginal hysterectomy plus, the total abdominal hysterectomy. And yes, laparoscopy. For laparoscopy, they are going to ask maybe the insufflation, the how you are going to do the, the insufflation, what is the pressure, what is the safety check at that point, and that's it. I don't
so
think, they are going to
the
go against basics.
so procedure, what you will advise us to read that hysteroscopy, laparoscopy,
I think
and
there
then.
is RCOG basic practical skills book. Okay.
Mhm.
RCOG basic practical skills book. So, I mean, do go through that book. That is important. And there are
Mhm.
some, the videos on Vimeo channel of RCOG as well. I think laparoscopy they do have, hysteroscopy they do have, and they do have consent, the for the laparoscopy too, which I
Mhm.
remember, and some of the others as well. So go through Vimeo channel. That is, the beautiful.
Fetal blood sampling, and
Yes,
then
yes, 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 yes. Of
that
course,
is for
yes.
ventricles. Yeah.
Hmm.
Ma'am, please,
Yeah. Thank you
in
very
the,
much.
Mm-hmm.
ma'am,
Mm-hmm.
yeah,
Mm-hmm.
in the consent forms, ma'am, there are a lot of, numbers and incidents. So, how could we remember it?
No, you don't have to utter all those numbers, but at least know the important one. The common, serious, but the very rare, that is important. Okay, common and serious, these you should have to tell at least in numbers, because these are important. How common it is, for example, in the wound infection, for example, return to theater, for example, if it is, the blood transfusion, if you think it is common for any procedure, so of course at least you have to, remember that. Nobody's asking you that, just the memorize all this, but at least common and serious and rare, because serious and rare are going to be in the same. Yeah, for example, if it is, the serious bowel injury in some of the procedure, bladder injury, vascular injury, okay, and the rare is going to be the death. Okay, so
Yes,
these
ma'am.
these at least you have to, to tell her. And yes, at the same time, if you are talking about risk, so tell her what we are going to do to reduce those risks, what we are going to do. For example, if you're talking about risk, you are taking consent. And if you're talking about, the common risk can be that you can have pain, but we can give you some, the suitable painkillers to relieve that pain. If you there can be infection, so we will give you suitable antibiotics to reduce that infection, at the same time. Negate that. Okay, just tell her that what you are going to do to, the negate that situation or the risk. Okay.
Yes, ma'am. Thank you. Thank you.
Okay.
At same time, we have to write it down also, and if
If
we
there
need
is,
to. Yeah.
if you are in face to face, of course you have to write it
Yeah.
down as well, because you will
Mhm.
have a consent form on the table too. So you have to pick it, but take permission from, the examiner. So can I take this, sir? So yes. So, at the same time you are going to fill it. So don't forget, the normal and, the manners as well. This is important. Okay.
Yeah. Thank you.
Okay. Great. Any other question?
Pray for us, please.
All prayers for you. Definitely. I know, this is a very stressful time because, the before exam, it is very stressful. So just be yourself. Okay. In exam, just be yourself. Don't try to imitate anyone. Don't just try to utter, the set sentences, set templates. Trust me, you will, remember by my words after your exam, inshallah. Okay. You will see that, okay, what I have been, the memorizing the templates, that is not going to work. Okay. It is not going to work at all. It is not going to work. Doesn't matter how, the much of the material do you have and you have collected from here and there. It's not going to help at all. What's going to help is that how you are going to behave in that particular, the situation. Okay. So again, you still have got time. Revise your stuff. Okay. Try to, the revise your, the guidelines. Try to rehearse. In the end, it's a good idea that if you take, the off from your work as well, if somebody is working, so 10 to 12 days at least, so you can focus on your, the preparation. So take off from your work. Okay. So just give, the full throttle preparation. Start from the morning and, try to practice as much as possible. Okay. So in the end, for the last 2 to 3 days, don't practice anything, but just revise. Okay, just revise very calmly. Or if you want to listen to anything, so you can listen to any, or if you want to watch, any audio, video, or anything, it's going to help. In the last 2 days, 3 days, save your energies as much as possible, because of course in real exam you have to utilize that energy too. Okay.
Dr. Zeb, only
Mhm.
we can you tell us something that about the negotiation session that always we are struggling with this, and if any
Negotiation, of
negotiation.
course. Yes, any negotiation station, for example, you have to the common one which comes as the we back, and she is coming to you for the labor choices. Yeah. So if she has had, the previous scar and now she is here for the the choices of the birth. So you will give, the all three options first, okay, all two options first, and then you are going to talk about, which one is going to be suitable for her. Likewise, for the contraception, don't just fix your mind that, okay, we know deep down that, okay, this copper IUCD is, the good for her, but at least tell her that, we do have all these choices, but I'm afraid this is not going to be good for you. But I think that, this is not going to be suitable because you have this at the same time. Okay. So don't just try to give, the complete information regarding that particular thing. All right. And in negotiation, if patient is adamant, that no, I have to go for this, I have to go for this. So in that scenario, you can only tell that, okay, if you still think that you are, for this procedure or for anything whatsoever, so I will, get you in touch with my consultant. And then, you can talk, the more about it. And meanwhile, I will give you patient information leaflet, because you have done your job. You have done, this is not your job that you have to take, you have to bring her to the point, the in which, she's, if she is not coming, or maybe, she has any hidden agenda. So try to find out in not so many words that you can ask that, can I know that what exactly is bothering you? Why do
Mhm.
you think that this is a good option for you? Can you please tell me that, why you think that this is going to be suitable option for you? Always
Mhm.
remember that if somebody is asking for home birth, or somebody is adamant for vaginal birth, there is going to be, the sum of the background knowledge. Yes, doctor, my friend has had a very bad, the experience with the cesarean section, so that's why I'm very much afraid. Oh, I'm so sorry that your friend had to go through this. So how is she doing now? Yeah, she's fine, doctor, but I'm very upset. That's why I don't want. See, look, Helen, what happens is that, every woman behaves differently in labor. And then the counseling will start. Of course, you're not going to tell that, not in, so many words that, okay, whatever has happened to your friend, so it's not going to happen to you. But still, I don't know what exactly has happened to your friend. Okay. So
Mhm.
but I'm so sorry that that has happened to her, but for you I can say that, that these are the options available for you, whichever option you will choose for yourself. So, we will respect that. Okay. So most of the time, the role player asks another question: if you were at my place, what you will choose? Okay. So
Yeah.
never say that, if I'll be in your shoe, the place, I will choose this. No, I cannot be you, you cannot be me. Okay. So you can say that, So you can, give a, the half smile like we do. You can say that, well, I don't know, if I were at your place, that how would I respond to this situation? Okay, but I don't know. But if you just ask me that, which one is going to be suitable for you? So out of these options, so maybe, this option is suitable for you. Okay. So don't respond to this that if I were at your place, I will be choosing, the so and so or so and so. Okay.
Mhm. Yeah. So which one she asks that her choice, that one I'll explain first. And then I can ask her permission. Do you want me to explain the other option also? Do you want me to explain that? So if she's agree, then I can explain the other option. Otherwise, if she'll tell no, I don't like to explain that one. So
No, no,
should
no,
I?
no, no, no,
I
no,
don't
no,
need.
no. No,
No.
no, 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 no. This is very, if she's saying that, I just want to go for, this, for example, the cesarean section on, the request, or cesarean section because of any reason whatsoever. So you have to
Mhm.
explore first. Okay. So,
Mhm.
okay. If you are talking in terms of that, she's here for sterilization and she's very young, and then you can say that, okay, let me tell you about, what sterilization is going to be. And then you can say that, Helen, let me just tell you that, apart from this, the sterilization, we do have a couple of good options as well. We call it as long acting reversible contraception. Would you like to hear about them as well? Because it is also going to protect you from unwanted pregnancies as well. Okay. So I
Mhm.
mean, not in so many words that if you will, she will say that no, 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 I don't want to. But this is going to be your choice. So word, because in this particular scenario, you're not going to give, or you're not going to give her a false, the hope that at 26 years of age that okay, go for, this sterilization process. So of course that is not very good. You are going to tell her about, the sterilization in 2 3 lines, that how the procedure is going to be. Then you are going to tell her about, the complications as well, the risk as well, in fact. Okay. So this is how you are going to say it. Then you can say that yes, it is a very good, the option for, the contraception, but this is going to be a permanent, the contraception choice. And then you can say that, if at any point if you would like to have reversal, so I'm afraid, that is not going to be, the first of all funded by the NHS, and secondly, maybe, it is going to be a little bit tricky later on, that how we are going to reverse it. And thirdly, I understand that you are so overwhelmed because, you have 3 kids, and, you don't want to have more kids, but, just to avoid unintended or unwanted pregnancies, so we do have a couple of other options as well. So shall I tell you about that? Mhm. So,
Mhm.
this is just going to be, on your choice of words, how you choose.
Mhm.
Otherwise, of course, the patient will have set agenda, that on which, they have to talk and how they are going to behave.
Mhm.
Okay.
Like
So this is
like
you have to take the the control of the station.
Yeah, like ectopic pregnancy, maybe it is 2.3 centimeter, and beta HCG 3,000. So it
Mhm.
is suitable for conservative and also medical management, surgical management. But patient, say for example, she wants surgical management. I want surgical management.
Mhm.
So then I'll ask her that why you want. Yeah.
Yes, ask her.
After that,
Ask her.
yeah,
Explore her
yeah.
concern.
Yeah, then after that I'll explain her that yes, there is a conservative management, there is a surgical medical management, surgical management. So if she wants the surgical, I'll explain that one first, then I can tell her that do you want me to explain the other option.
No, no, tell her, normally, just ask her that, that am I clear so far? So let me tell you about the other option. Let me tell you about the third option. Okay. So simply
Mm-hmm.
take the control of, the station.
Mm-hmm.
Okay, take the control of your station after, the few minutes. So it should be you who should be leading the station. Okay, it should be you, the who will be asking the questions from the patient all the time. Okay. And after, the giving information regarding, the one procedure, ask her that am I clear so far? Is it, is it okay that, are you with me? Anything, however, the whichever sentence you want to choose. So do try
Mm-hmm.
to ask in that.
Okay.
Okay, very
Because I
good.
can remember my last exam, that the surgical management, the ectopic pregnancy. So I asked her, she told no need to explain the other one. So I explained the surgical management.
then you would have asked that, can I know that why you wouldn't, that why you don't like to, the listen to the other options? So then you can simply say that, I'm just going to tell you that we have got a couple of other options as well. Okay, I'm not saying that you have to choose any of them.
Yeah. Then it will be informed choice.
Of course, of course.
Yeah. Yeah.
Mhm.
Thank you very
This
much.
is how you can address.
Yeah. Thank you.
Okay, very good. Thank you so much, everyone. So all the very best to all of you who are going for November exam. Okay, just give your 100%. Fight for every station. Don't get tired. Okay, and don't be upset after the exam as well. Okay, exam is going to be exam, and take it like the other exams as well. It is not the matter of the life and death. Okay, I have failed this exam, I have passed this exam. Today I'm sitting in front of you. So it doesn't mean that, after failing one exam, I'm going to be, the less capable of going for any of the exam. Okay. So one exam does not, what you can say, that signify that, the how good student you are or how good doctor you are. Okay. It can be, the important at one place, but don't make it as a, the choice of life and death. Okay. Being, the upset is okay. Being, the kind of depressed is okay. Anxious is okay. But don't make it as, the matter of life and death. Okay. Just go for it and just give your 100%. In the end, of course, the things are going to be what you are going to perform on that certain day. Okay, that is going to be a kind of the day for you. Doesn't matter the how good you are performing here and there, how good you are, or how well read you are, or how the fluent you are, the how the good candidate you are, the here and there in the stations. Okay, so be extremely the confident. Like I said, that just have control on your nerves. Even in the 2 minutes time, if you think that I don't know much about of this station, so take it as the station, like which you are the handling. For example, the module is going to be same. Okay, so start your module. Okay, start your the template. Ask the woman, can I know that what has the brought to you there. Okay, can I know that the what are your expectations and the concerns with regard to this consultation. So anything, you will get enough hint. Okay, so
Dr.
just stay calm, stay composed. Okay.
Dr. Zaib, last question, please. If any patient that already diagnosed with history and investigation like stress urinary incontinence or any other like polycystic ovarian syndrome, diagnosed already with a scan and all that hormone level, everything.
Mhm.
So do you think if it is diagnosed already, so I can ask history related with this, or I'll ask differential
Look at the
diagnosis?
task. What is your task? Okay, what task you have to perform? If the task is that you have to explain her the investigation, you have to tell her regarding the management, then of course you have to take the relevant history, and then of course you are going to tell that, do you know what exactly has anybody spoken to you about the reports? Has anybody discussed with you about the the reports?
No,
So
I'm asking only history, that like PCOS already diagnosed, that ultrasound given,
so what is
investigation all
going to be
given.
the task? You didn't get me. What is going to be
Yeah,
the task? That is your
yeah,
question.
yeah. It is written
Okay,
that
look at the
history
task.
management plan. You will ask and explain the report. Okay.
Yes,
So
yes.
at the time, only history. I'll ask a relevant history according to the
Relevant, of course.
PCOS.
Relevant,
PCOS.
relevant,
Is it?
relevant history, of course.
No need differential diagnosis. All to take history differential diagnosis
If
if
you
it is
think if
diagnosed.
it is coming along with your, the history points, if she is telling you, if she is giving you enough information, if you think that it can fit in another differential of the hirsutism or acne or anything. So I mean, this is your job. Then how you are going to extract the information. Okay.
Mhm. Yeah.
Mhm. Okay, so thank you so much, everyone. So all the very best from my
Thank you very
side.
much.
So I hope, inshallah, you guys will do good. Okay, so just go with the positive mind and the positive attitude toward exam. And this is another exam like you have always been, the going for. Okay, so all the very best. Take good care of yourself, and that's it. If anyone has any query, anything, you guys can write to me. Okay, on the Telegram, on Facebook, WhatsApp, the wherever. So I'm easily approachable, so I will try to be as responsive as early as possible. Okay,
Thank
all
you.
the very best, guys.
We'll remember you. Thank you very much.
Thank you so much. Thank you so much, Salma.
Assalamu alaikum.
Alaikum Assalam. Okay, bye bye. Bye bye, guys.
Thank you, ma'am. Thank you. Bye.
Thank you very much, Dr. Sir.